Free medical and study games about ABO review EXA. The average convergence for eyes when reading is 4 millimeters. How do we verify slab off in glasses? Using the lens clock. The ideal base curve in a lens is plus 6.00d. Rx-2.00 plus 3.00 x 45. What is the deficiency? Mixed astigmatism. Plano 2.00 x 90. How much power does this lens have at 90? No power. In bilateral compound hyperopic astigmatism, the images are formed underscore 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 underscore. Both images behind the retina in both eyes. This lenses change shade depending on the amount of UV rays striking them. Photochromic transitions. What is bicentric grinding? Slab off. True or false, the cones function at night? False. Limbus is surrounded by the cornea. 4.00 plus 4.00 x 175 OU. The deficiency of this Rx is bilateral simple myopic astigmatism SMA. Which lens design would you use for a high plus Rx? An aspheric design. If the eyelashes of the patient rub the back side of the lenses, the fitter should increase vertex distance. A plano lens has a plus 6.00d base curve. How much is the ocular curve? 6.00d. If the right temple of a frame is angled out, this adjustment will result in the right side of the frame front to be closer to the right eye. What would you recommend to a golf player? RD22 segment in the upper temporal corner. The transition zone between the cornea and the sclera is the limbus. When the right temple is angled down, this adjustment will underscore 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 underscore. Raise the right side of the frame up. Recommended for nighttime driving. Anti-reflection coating, AR. This material frame will bend when heated and will return to its original shape. Optil. Light rays passing through a prism are deviated towards the base. The standard progressive has how many measurable optical centers? 2. A number 3 tint absorbs how many % of light entering the lens? 80%. Reverse slab off is base down prism in a bifocal lens. The oldest material used for glasses. Glass lenses. A slab off is used for the correction of excessive prism imbalance in the reading level of a bifocal lens. A minus base curve lens. Myodisk. The cells of the retina. Cones and rods. Patient looking through 1 by carat OD, 1 bow carat OS. How much is the carat imbalance? No carat imbalance by in bow or cancelling carat. What are CRT lenses? Cathode ray tube used for computer programmers consist of UV, tint, and ET coating. You cannot use alcohol to clean this frame material. Polycarbonate. The height from which the steel drop ball used for the drop ball test is dropped is 50-inch. The distance between the focal point and the lens is called the focal length. If the OC of the right lens is at quadrant 3 in the lensometer, what is the prism? BD and bow prisms. To correct esophoria patients need bow prism. What does prism do to light? Deviate, displace, disperse. To lengthen a short or wide face underscore 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 underscore. Recommend a high temple. A round frame is marked 52/18. What is the effective diameter of this frame? It equals 52. Anisometropia is when the Rx in OD and OS is 1.50 d or more different from each other. An uncoated glass lens, tinted GRY number 3 with an Rx of -5.00 d will have a tint that's darker around the edges than center. For every 2 degrees of pantoscopic tilt, the optical center should be lowered or raised by 1 mm. To change an Rx from plus form to a minus form is called transposing. This frame type should be soaked overnight periodically. Nylon. Name the extrinsic muscles underscore 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 2 oblique and 4 recti muscles. If you see a high plus Rx that has been changed to a regular Rx with an add of plus 3.00, the patient has a condition called underscore 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 pseudophakia. What style bridge do we use to lengthen a short nose? Keyhole bridge. Correct this imbalance by slab off, 10 mm reading level, OD plus 5.00-2.00 x 90 OS plus 3.37-3.00 x 90. 1.63 BU in OS. What does ABO value stand for? The measurement of chromatic aberrations distortions. What would you recommend for fishing? Polarized lenses. What is the spherical equivalent of -3.00 plus 3.00 x 90? 1.50 ds. The average pupil size under normal lighting is 3 to 5 mm. The steeper the curve, the power stronger. The higher the refractive index, the more of less the UV absorption. More. An area of retinal vision loss. Scotoma. To move the frames closer to the face, we spread the nose pads, widen the bridge. A meniscus lens can have what type surfaces? Convex, concave, plano. An average human eye is how long? 1 1/8 inches. Emetropes. A normal eye, no correction needed. What is a quadrifocal lens? A trifocal with an inverted FT bifocal. What is the patient tolerance for prism imbalance in the horizontal meridian? 2/3 prism diopters. The muscles of the eye responsible for changing the shape of the crystalline lens are ciliary muscles. The breaking up of white light onto its component colors by prism is called dispersion. The vertical difference in power between the lenses in this Rx is OD plus 1.00-0.50 x 45 OS plus 1.00-0.50 x 90. 0.25 D. A person that has the entire crystalline lens removed is aphakic. True or false, photochromic lenses get darker on hot days than on cold days. False, the opposite. This lens has with motion. Minus lens. The sphere lines focus on plus 1.00 D, the cylinder lines focus on dash 1.25 D. What is the power of the cylinder for this lens? Dash 2.25 D. A compound hyperopic patient needs a, to correct it. Plus toric lens. In round RD22 bifocal segment, the OC is where? In the center of the seg at 11 mm. What is the prism tolerance in the vertical meridian based on ANSI standards? 1/3 of prism diopter. The two types of prism in glasses are 1. Unwanted or induced. 2. Prescribed. Distance Rx is dash 15.00 ds or mechanical PD is 68 mm. Patient PD is 64 mm. How much prism is patient looking through? 3.0 carat by each eye. Wavelengths shorter than 380 nanometers are UV, ultraviolet. A patient is wearing glasses with two prism diopters base up each eye. How much prism is the patient looking through? No prism, zero imbalance. The middle layer of the eyeball consists of choroid, ciliary body, iris. True or false, the ocular curve of the lenses is always convex. False, it's always concave. This plastic material frame can be bent with or without heat applied. ZIL. An object viewed through a prism appears towards the apex. Higher the specific gravity, Sg, of a material, heavier or lighter. Heavier the lens. To move the right lens higher on the face, we adjust by bringing the right temple up. The agency responsible for developing standards for product tolerances. ANSI, American National Standards Institute. What are the true powers of this Rx, 6.50 plus 3.50 x 65? 6.50 at 65 slash 3.00 at 155. Which lens materials block ultraviolet rays automatically? 1. Polycarbonate. 2. High index. 3. Trivax. To increase reflection, we use mirror coating. A longer than normal eye size causes myopia. To take the PPD, the dispenser should be positioned how far from the patient? 40 centimeters. The pantoscopic tilt can be increased up to how much? 18 degrees. What color tint is recommended for night driving? Clear, no color. This frame material can be safely heated up to 200 degrees Celsius. Optil. Light rays emanating from an object will be diverging. Made of iron and chrome, combines flexibility with strength and durability. This frame material is stainless steel. A series of prisms stacked one on top of the other can be cut to apply to any shape, with scissors. Fresnel prisms. Isometropic prescription is an Rx having the same power and sign for each eye. The Prentice's rule formula states carat equals diopter x decent ration slash 10. The ingredient used in photochromic lenses that causes the lens to darken when exposed to UV is underscore 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 underscore. Silver halide. The orthoscopic tilt is when the eyewear has no angle and it is straight with no curve. To shorten the long nose. Chose a low bridge, saddle bridge. What is the distance from the geometric center to the top of the segment frame, A55, B46, DBL 22, Seg HT 17? 6 millimeters. The best impact resistant -10.00D lenses. Polycarbonate. A condition where the eye turns out occasionally is called exophoria. Points old Rx is -3.00ds, IT has A plus 6.00D base curve. New Rx is -5.00ds. What base curve would create the least amount of change on the ocular curve or surface? Plus 4.00. Plus 4.00-1.00 x 160 add plus 3.00 ft 28. Seg OC is 5 mm below the line. How much is the image jump carat? 1.5 carat. The formula for calculating refracting index. Speed of light in the air / speed of light in material. Plus 1.00 plus 2.50 x 90. What is the spherical equivalent? plus 2.25. This frame may be heated until it bends under its own weight. Optil. The cylinder axis tolerance for 0.75D cylinder is 5 degrees. The average ppd for adults is 50 to 75 millimeters. What is the horizontal and vertical poiers of this Rx? Plus 10.00-8.00 x 90. D equals plus 10.00 dH equals plus 2.00 D. To induce by prism in a plus lens, you'll move the lens what direction? In. Which of the following indicates the best visual acuity 20/15, 20/20, 20/30? 20/15. Amblyopia is often corrected by occluder lenses. Inner layer of the eyeball consists of 1 macula, 2 fovea centralis, 3 optic disc. The agency that's responsible for workplace safety and hazard control is OSHA, Occupational Safety and Health Administration. A plus 9.00D lens decentered 5 mm will induce how much prism? 4.5 carat. The best tint for shooting glasses is Calichrome, yellow tint. A lens with the focal length of 2 meters is how many diopters? 0.50D. The principal consumer protection agency of the federal government is the FDA, Food and Drug Administration. Active people should wear what type of temple style? Comfort cable / riding bow. A smart seg bifocal is underscore 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 underscore. A flat top bifocal with a progressive segment. For high-RX, use a small or large size frame. Smaller frames will produce thinner lenses. Where is the crystalline lens located? Behind the iris and the pupil. The image jump formula is underscore 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 underscore. IJ carat equals add power x reading level /10. Antimetropia is an RX with the OD and OS having opposite signs. The lens clock is also used to check what? Slab off on the lenses. What does the refracting structure of the eye consist of? The cornea, the crystalline lens, the aqueous humor, vitreous body. Excessive intraocular pressure leads to glaucoma. The connection of only 3 points, which pressure may be applied to the face. The fitting triangle. The agency responsible for prescription release laws with no disclaimer is FTC, Federal Trade Commission. True or false, when changing or increasing the index of refraction of a lens, you change the speed of light traveling through the lens. True, the speed of light will change. The distance that the optician measures with the distometer is called FVD, fitted vertex distance. Which one of the following focal lengths has the strongest power? 20 inch, 40, 80. 20 inch. Vertex distance compensation for contact lenses is most needed for RXs which begin at underscore 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 plus / 4.00D. RX OD minus 8.00 to 2.00 x 80 OS balance. What lens would you order for the left eye? What material would you order for patient? Left eye RX would be the same as right eye. Because of safety use only polycarbonate lens. Slab off is used when there's a vertical imbalance of at least underscore 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 1.50D. How do we determine the ideal base curve of a plus lens? 1. Determine the true powers. 2. Add plus 4.00D to the highest true power to get the BC. If a patient does not have prism in his RX, the optic centers of his glasses should be in front of the pupils. The instrument to check the vertex distance. Distometer. Exotropia can be corrected with underscore 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 basin prism. What is the power of the cylinder at 180 axis plus 1.50 plus 2.00 x 180 plus 0.00D? The right ear of a patient is lower than the left ear. What should the optician do? Bring the left temple up. This lens has one power in all medians. Sphere lens. The cylinder axis tolerance for a 0.25D cylinder lens based on ANSI standards. 7 degrees. An unbreakable plastic frame that's also hypoallergenic is nylon. The physiological blind spot is when the image is formed on the optic disc. The prism measurement indicator found in the lensometer is the reticle. To eliminate a gap between the lens and a metal eyewear we use lens liners. Refractive index formula. Speed of light in air / speed of light in material. What is responsible for central vision and visual acuity? The macula. What is the chemical used in AR coating to reduce glare on lenses? Magnesium fluoride. The point of no refraction is a lens is the optical center. The frame differences. The difference between A and B measurement of a frame. In round frames the frame difference is 0, 0. What is the C measurement? It's the width of the lens along the central datum line, circumference. What instrument measures the curves of a lens? A lens clock. If the bifocal segs are too low, how do we fix it? Narrow the bridge, decrease the pantoscopic tilt. plus 3.00 plus 1.00 x 45 4 carat BU plus 2.50 plus 1.50 x 135 3 carat BO. Split the prism in the RX. OD2 BU, 1.5 BO OS2 BD, 1.5 BO. The focal length of a 2.00 D lens in inches is 20 inch. RX is -12.00 D. RVD equals 11 mm, FVD equals 16 mm. What RX would you order for patient? -12.50 D. The unit of lens power is diopter. Which cells of the retina are responsible for peripheral vision? Rods. Used to check the glass lenses for heat treating. Colmoscope or polariscope. What are the component colors of white light? Roigbiv: red, orange, yellow, green, indigo, violet. The prism base of a plus lens is underscore 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 underscore. At the optical center. The focal length of a 4.00 D lens in cm is 25 centimeters. The ability to maintain single binocular vision with both eyes is called fusion. To reduce reflection and increase transmission, we use AR anti-reflection coating. If the frame dimensions are A equals 50, ED equals 55 and the frame difference of 8 mm, what is the B measurement? 42 mm. What is ptosis? Droopy eyelids. The distance between the cornea and the center of the lens on ocular curve is vertex distance. Minimum thickness of safety prescription lenses 3.0 mm center. The power of a lens depends on what factors? The curves, the refractive index, the thickness of the lens, the vertex distance. These lenses have a central area with the perceived lens power and a peripheral area of little or no power. Lenticular lenses, used for very high plus prescriptions. CR39 lenses are thinner than glass lenses. True, false? False. A patient's PD is 68/64. What's the seg inset? 68 minus 64 halves equals 4 divided by 2 is equal to 2. Inset formula is PD PD PN PD/2. Patient looking through 2 BUOD, 2 BDOS. How much is the imbalance? For diopters. A frame type that has only one point of attachment. Nomad. Lower the ABO hashtag of a material, the higher or lower the aberration or distortion. Greater the chromatic aberration. The MRP of a progressive lens is where? 2 to 4 mm below the fitting cross. The best lens for reducing glare problem is polarized lenses. To shorten a long face, what frame recommendations do we make? Mid or low temple, low bridge, deeper frames. How many diopters is 125 cm focal length? 8.00 D. This frame material may shrink as heat is applied. Polyamide. The physiological blind spot is at underscore 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 underscore. The optic disc. This person uses accommodation to see distance clearly. A hyperope. 3.00-2.50 x 180 at plus 2.50. What is the reading Rx? 0.50-2.50 x 180. To determine the base curvature of a minus lens, what are the procedures? 1. Determine the true powers. 2. Select the stronger true power. 3. If plus, add 4.00d to the stronger TP. 4. If minus, between PL to minus 8.00, add plus 8.00 to the stronger TP between minus 8.25 to minus 15.00. Use plano BC over minus 15.00. Use myodisc or biconcave. The transition zone between the cornea and the sclera is underscore 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 underscore. The limbus. Bifocals and trifocals are constructed in three ways. They are: 1. Fused, glass, 2. One-piece, 3. Cemented. Plus 2.50-3.00 x 45 OU FPD equals 72, PD equals 66. Lab decentiered lenses wrong way. What's the prism imbalance? 1.2 carat diopters. Absorption of light in a lens can be increased by tinting the lenses. This material is very soft and requires scratch resistance coating. Polycarbonate. Which frame material is hypoallergenic? Nylon. The best frame bridge for a person with long nose is saddle bridge. The cylinder axis tolerance for A-1.00D cylinder based on ANSI standards is 3 degrees off axis. The cavities inside of the eye are underscore 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 underscore. 1. Anterior cavity. 2. Posterior cavity. The amount of light entering the eye is controlled by the iris. The smaller the radius, the focal length. Shorter. How long should we keep the patient's records in the office? 3 years. How do we correct ptosis? Using ptosis crutch. If the frame sits too high on the face, stretch the bridge or spread the nose pads. A reverse slab off should be used in the eye which has the most plus or least minus. The final step in fitting a frame to a patient is adjust the temples. The first plastic material used for glasses was CR39, Colombian resin badge 39. As the focal length of a lens increases, the diopter power will decrease. As refractivity index increases, the thickness of the lens will decrease. Each lens curve has a diopter value. The diopter value of a curve depends on underscore 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 its radius. What are advantages of AR coating? Increased transmission, reduced glare due to reduced reflection. The area of the retina responsible for sharpest image is macula. Images formed on the retina are transmitted to the brain by the underscore 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 optic nerve. An operation done to remove the corneal scars. Keratoplasty. The cells of the retina that are located on the macula are cones. Tolerance for seg height location based on ANSI standards is within 1 mm of specification. What's the best tint for sensitivity to light indoors? Rose. 2 ways of hardening glass lenses are heat treating, chemical treating. The function of the ciliary muscles. To change the shape of the crystalline lens. What would you recommend to an aphakic patient? UV protection. A tendency of the eye to deviate from its normal position is aphoria. Seeing one object as two, double vision. Diplopia. In compound myopia, the images are formed where? Both anterior to the retina. A plus lens moved downward from its primary position will result in what base prism? BD caret base down. The main reason for using lenticular lenses for high powers is that they are less expensive. True or false? True. A progressive wearer complains of narrow reading area. What would you do? Decrease the vertex distance. If the nose pads are both causing an indentation on the nose, what's the cause? This means that the nose pads are too small for the frame weight. Plus 8.00-4.00 x 90. What is the power at 180? Plus 4.00 d. When a base curve of a lens is flatter than the ocular curve, what lens design is this? Minus meniscus. The outer layer of the eyeball consists of sclera, cornea, limbus. What would you recommend to a pilot who flies in cloudy areas? Yellow tint, to increase contrast. This metal material holds shape the best of all metal frames. Nickel silver. Standard bifocal lenses have an intermediate power that is 50% of the near ad. This lens creates a real image. Plus lenses. What is at the center of the macula? Fovea centralis. This facial shape can wear any style and shape frame. Oval. This tool is used to measure lens thickness. Lens caliper. Rx plus 2.75-1.25 x 135. The refractive anomaly indicated by this Rx is Cha compound hyperopic astigmatism. For each 2 degrees of pantoscopic tilt, lower the OC of the lens by underscore 1 millimeter. A patient is pseudophakic in the OD and has cataracts in the OS and is waiting for surgery. OD plus 1.00-0.50 x 85 OS 2.00-1.00 x 90. Would you order slab off? No, give balance lens for OS and wait for surgery. A concave, convex lens is called a meniscus lens. Speed of light in the air is 186,000 mph. How much do the eyes converge when reading? 3 to 4 mm. Light is part of the electromagnetic spectrum ranging between and m 380 and 760. Abnormal sensitivity to light. Photophobia. The ratio of light entering the lens to the ratio of light exiting the lens is transmission. This measurement is twice the longest radius of the frame. At effective diameter. Light rays originating from a distant object will be described as parallel light. The front surface of this lens has a curve that gradually flattens or steepens as it moves away from the optical center. Aspheric lenses. The drop ball test is a 5/8 steel ball dropped from a height of 50 to test glass lenses safety. When selecting frames for the elderly, the most important factor to consider: weight of the glasses or frames. The distance from the ocular surface of the lens to the apex of the cornea is vertex distance. Directing the visual axis of the eyes to a near point is underscore 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 underscore. Convergence. The distance that the refractionist used when performing your eye exam is called RVD, refracted vertex distance. When decentering for bifocal lenses, we use which PD? Near PD. To induce base-up prism in a minus lens, you'll move the lens what direction? Down. The distance between the geometric center of the frame to the wearer's PD is inset or outset, FPD/PPD/2. Blue blocker lenses are reddish-orange lenses used for cataract patients. Blue blockers cut off the blue and shorter wavelengths, less than 510 nanometers. Decentering a minus lens downward will cause prism with base direction. Base-up prism. If the FPD is more than the PPD, do we apply positive face form or negative face form? Positive face form. The standard refractive index for the calibration is 1.530. This lens has one meridian that has no effect on light. The real power of the lens is located 90 degrees away. A cylinder lens. The main function of the sclera is To protect the eyeball. The agency responsible for public health production and sale of food and drugs is FDA. Food and Drug Association. The most common cause for frames being misaligned is XING. Bridge being bent. The center of the metal block is called the mechanical center. The cylinder axis tolerance for a 2.00D cylinder lens based on ANSI standards. 2 degrees. What is the horizontal and vertical powers of plano 6.00 x 90? H equals dash 6.00 at 180 V equals plano at 90. An ametrope is an eye that needs refractive correction or glasses or contacts. The two muscles of the iris are sphincter, dilator. Which lens cuts off wavelengths of less than 500 nanometers? Blue blockers. This lens has the same curvature in all meridians. Sphere lens. When the eyewear has no tilt or angle and is straight. Orthoscopic tilt. The measurement of the density or the weight of a material is called specific gravity, SG. Plus 4.00-2.00 x 180. If PD is 5 mm too narrow, how much is the induced prism and what base direction? 2 carat diopters base in. Another name for a biconcave lens. Myodisc. Part of the eye responsible for 80% of light reflection is the cornea. Vertex distance compensation for spectacles is most needed for RX, which begins at underscore 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 plus / 7.00D. Calichrome lenses are recommended for who? Sharpshooters. The fine lines on the lensometer focus at plus 0.75D and the coarse lines focus on minus 1.50. The axis wheel is on 20 degrees. What's the RX? Plus 0.75-2.25 x 20. The two types of strabismus are underscore 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 1. Phoria. 2. Tropia. A plus lens moving away from the eye will change in power. How? It will gain power, become more plus. 2.25-0.75 x 170 add plus 2.50. What is the intermediate RX? 1.00-0.75 x 170. The steps of finishing a lens in correct order are 1. Calculations. 2. Spotting. 3. Centration. 4. Blocking. 5. Edging. The geometric center is the point where A and B intersect. The mechanical PD is the distance between the optic centers of the lenses in a finished pair of glasses. These glasses need to be soaked in water monthly to avoid drying out and breaking. Nylon. What is the geometric center distance of a frame that's marked 52/17? 69 mm, GCD equals FPD. Normal pantoscopic tilt is about 80 to 10 degrees. The fitting triangle is connecting of only 3 points which pressure can be exerted: 1, crest of the nose; 2 and 3, both sides of head just above the roots of the ears.